Hi, it's Kirsten. I want to have a little chat about pelvic organ prolapse. So many of my clients come in and they're really upset with a diagnosis or concerns that they have a pelvic organ prolapse. So cystocele, a rectocele, a uterine prolapse, and they're wondering what to do with this and are they alone? No. So current stats show 50% of women will have a pelvic organ prolapse at some time during their life. But it is more than that because a lot of the women who have a grade 1 prolapse, which is just mild, it means there's just a little slump of the vaginal walls where the organs are kind of slumping into. They don't have any symptoms of it. So they're not going to their GP or their OBGYN and getting a diagnosis of pelvic organ prolapse. Usually it's when the prolapse is at the entrance of the vagina and you feel a bulge in the vagina, that's a grade 2. Or if it's gone past and you actually feel tissue extruding out of the vagina, a grade 3, and you want to push that tissue back in. Those are the people that are actually going in and getting that diagnosis. So many of us have pelvic organ prolapse, but it's mild enough that we're not really feeling the symptoms. And if you do have symptoms of pelvic organ prolapse, you want to make sure your pelvic floor is functioning properly. It's not too tight, it's not too weak, that you can start doing some Kegels to support the organs. So if you have a grade 2 prolapse or a fairly substantial grade 1, that's kind of going in towards a 2, you might feel that heaviness. And if you do some Kegels, you can really make you feel like you're supporting the organs and you don't have the symptoms of the pelvic organ prolapse anymore, and you have a better functioning pelvic floor. So how do you know whether you're doing a Kegel properly? Well, I have a video on that, so you can check that out. But also, if you're really tight and you're doing tons of Kegels, it can actually make the symptoms feel worse. So you don't want a tight pelvic floor. You want a pelvic floor that's relaxed and able to do a Kegel properly and then relax back out again. And that will help to support the organs. Do we reverse it? No. I never tell my clients that I can reverse their pelvic organ prolapse. There's some studies showing that your prolapse can shift somewhat, but we don't take a prolapse that's coming out of the vagina and then reverse it back up to a grade 1. That's not anything that we're telling our clients that we can do. But what we're doing is when you have a good, strong pelvic floor, you can not have the symptoms of the prolapse and you can kind of go about your days normally and not feel like you're hanging or feel the heaviness in the vagina. Okay, I hope that helped to clarify a little bit. If you want some more information on this, ask below and put some comments in, and you can push that like button, and I hope that's helped.